The female reproductive system is a complex and intricate network of organs and structures that work together to facilitate reproduction. It plays a vital role not only in the production of ova, egg cells, but also in hormonal regulation, fertilization, pregnancy, childbirth, and menstrual cycles. This system is primarily located within the pelvic region of the body and is responsible for sustaining and nurturing new life. It consists of both internal and external organs, each with its own unique functions and significance in the reproductive process. The female reproductive system is divided into internal and external structures. The internal reproductive organs include the ovaries, fallopian tubes, uterus, and vagina, while the external genitalia include the mons pubis, labia majora, labia minora, clitoris, and vaginal opening. The ovaries are a pair of small, almond-shaped organs located on either side of the uterus. They are responsible for producing female gametes, or egg cells, ova, as well as secreting vital hormones such as estrogen and progesterone. A female is born with approximately 1 to 2 million immature eggs, which decrease in number throughout life. Each month, during ovulation, one mature egg is released from an ovary into the fallopian tube, where it may be fertilized by sperm. The fallopian tubes, also known as uterine tubes or oviducts, are narrow, tube-like structures that connect the ovaries to the uterus. They serve as the primary site for fertilization, where the sperm meets the egg. The tubes contain cilia, tiny hair-like structures that help propel the egg toward the uterus. If fertilization occurs, the resulting zygote continues its journey to the uterus for implantation. The uterus, often referred to as the womb, is a pear-shaped, muscular organ that plays a crucial role in pregnancy. It has 3 layers: the perimetrium, outer layer, myometrium, middle muscular layer, and endometrium, inner lining. The endometrium undergoes cyclical changes throughout the menstrual cycle, thickening in preparation for a potential pregnancy. If fertilization does not occur, this lining sheds during menstruation. If an egg is fertilized, the uterus provides a nourishing environment for the developing embryo. The cervix is the lower, narrow portion of the uterus that connects to the vagina. It acts as a gateway between the uterus and the external environment. During childbirth, the cervix dilates to allow the passage of the baby. It also plays a role in fertility by producing cervical mucus that facilitates or inhibits sperm movement depending on the stage of the menstrual cycle. The vagina is a muscular, elastic canal that serves as the passageway for menstrual fluid, sexual intercourse, and childbirth. It extends from the cervix to the external genitalia and is lined with a mucous membrane that maintains a healthy environment by supporting beneficial bacteria and preventing infections. The vaginal walls are capable of stretching significantly, especially during childbirth. The external reproductive structures, collectively known as the vulva, include the mons pubis, labia majora, labia minora, clitoris, and vaginal opening. These structures protect the internal reproductive organs, play a role in sexual arousal, and provide an entryway to the vaginal canal. The clitoris, a highly sensitive organ, is rich in nerve endings and plays a significant role in sexual pleasure. The female reproductive system performs several essential functions that are crucial for reproductive health and overall well-being. Oogenesis, or egg production, occurs in the ovaries, where one mature egg is typically released each menstrual cycle. The system also plays a vital role in hormone production, with estrogen and progesterone regulating reproductive functions, maintaining secondary sexual characteristics, and preparing the body for pregnancy. Fertilization and conception occur when sperm meets an egg in the fallopian tube, forming a zygote that travels to the uterus for implantation. If fertilization does not take place, the thickened uterine lining is shed during menstruation, marking the start of a new cycle. The uterus supports fetal development, while the cervix and vagina facilitate childbirth. Additionally, the reproductive system supports lactation, as hormonal changes prepare the body for breastfeeding after childbirth. The menstrual cycle is a recurring process that prepares the female body for potential pregnancy. It is divided into 4 main phases: the menstrual phase, days 1 to 5, during which the uterine lining sheds; the follicular phase, days 6 to 14, when the ovaries prepare to release an egg and the endometrial lining thickens in response to rising estrogen levels; ovulation, day 14, when a mature egg is released from the ovary into the fallopian tube, increasing the chances of fertilization; and the luteal phase, days 15 to 28, when progesterone levels rise to maintain the uterine lining. If fertilization does not occur, hormone levels drop, triggering menstruation. Several conditions can affect the health and function of the female reproductive system, including polycystic ovary syndrome, PCOS, a hormonal disorder causing irregular menstruation and ovarian cysts; endometriosis, the growth of endometrial-like tissue outside the uterus, causing pain and infertility; fibroids, non-cancerous tumors in the uterus that can lead to heavy bleeding and discomfort; pelvic inflammatory disease, PID, infections affecting the reproductive organs, often caused by sexually transmitted infections, STIs; and menstrual disorders such as amenorrhea, absence of menstruation, or dysmenorrhea, painful periods. The female reproductive system is a complex yet essential system responsible for numerous biological functions, including reproduction, hormonal regulation, and pregnancy support. Its organs work harmoniously to facilitate the production and maturation of egg cells, the possibility of fertilization, and the development of new life. Understanding its structure, function, and potential disorders is crucial for maintaining reproductive health. Advances in medical science have enabled better diagnosis, treatment, and management of reproductive health issues, ensuring that women can lead healthy and fulfilling lives. Proper education, regular medical checkups, and a healthy lifestyle play a key role in maintaining the optimal functioning of the female reproductive system.